We're on the air. This is Radio Entrepreneurs. My name is Jeffrey Davis. Our next guest, Marty Sklar of AblaCor Medical Group. Tell us about AblaCor.
Well, AblaCor is an early stage company, of course. We're developing a minimally invasive technology to treat a really big and growing problem in the healthcare community, atrial fibrillation. More and more people are hearing about it. There's about an estimated upwards of 6 million people now diagnosed in the United States.
What does that mean?
Atrial fibrillation is the most common and most complex electrical problem in the heart today. And so,
and you know what? I think my son's friend just was diagnosed with that.
It could be
at a young age.
Yeah, it's more and more common in young people, but it's really most people that have it are, you know, as you grow older, more and more people have it when you grow older. It's a higher percentage, but it is more and more the diagnostic capability to determine that it exists.
Oh, so in the old days it was there, we just didn't know.
Right, exactly.
It's not that it's starting to show up again.
Well, they're not sure, but they're pretty sure it's more, the ability to diagnose it is much more prevalent today than it was years ago. Absolutely, that's certainly part of the equation.
Wow.
Why it's growing. But recent estimate, 6 million in the United States, 30 million worldwide. It's a growing problem, and it's causes 20% of strokes.
And how are you going to help this problem go away?
So at present, the present methods are medications are given, and of course a lot of people see.
And the medications are kind of yucky, aren't
well,
they?
yeah, there's antiarrhythmic drugs which you don't see on TV. What you see on TV for atrial fibrillation is the anti-stroke medication. So some people have said to me, well, there's medications available. You know, that's only for preventing of stroke. The antiarrhythmic drugs are very problematic. They have all kinds of side effects, and of course you have to take them on a regular chronic basis.
Well, I had a heart situation about 10 years ago. My cardiologist put me on a series of drugs. I ended up going to my GP, and I said to him, "You got to take me off this stuff. It's not always. It does affect you day to day."
Absolutely, absolutely. So what happens is when, in fact, most people don't get a positive impact out of the drugs. People become what's called refractory, or the drugs don't have an impact. Once they do have a positive impact for anybody, a very small percentage get an initial benefit from them. And when you don't have a benefit, the next major treatment, the most successful treatment at present, is called ablation, or the burning of tissue. And the purpose of that is to isolate this unwanted electrical activity that's in your heart. Basically, your heart's getting, instead of having a normal single signal, now you have another signal, electrical pathway that's causing the heart to actually beat at a much higher rapid rate, maybe a couple hundred beats a minute. And if you're symptomatic, not everybody has symptoms with this either. But if you are symptomatic, it's a real problem for your lifestyle. Your quality of life goes way down, you're tired, there are a lot of other symptoms. And so the only way to treat it successfully in the last 15 years has been to ablate or burn tissue using minimally invasive methods. So you go to an electrophysiologist who will perform this procedure. The problem is that we're trying to solve is that 40% of these procedures are repeated. So there's about 130,000.
So it's not really it's not the most reliable process.
It is not. It's very skill dependent. We are developing a device which will improve the ability of the electrophysiologist to perform this treatment and do it one time. Right now, people come back for second and third treatments. As I said, 40% of the ablation procedures are repeated. And so people get a second and sometimes a third treatment. And if we could remove those people and get more people can be treated initially, the 130,000 procedures that are being done. Also, a lot of physicians, there's about 2,000 or so electrophysiologists in the United States, and we estimate maybe 800 do the bulk of those 130,000 or so procedures performed. Well, the others don't pick up this procedure because it's a very tedious, very difficult, and not really cost effective for them from a financial standpoint. They can be doing other procedures. So we're going to make this a much more attractive procedure by performing really creating an ablation that's reliable.
If someone wants to help you get it off the ground, know more about the business, how do they find you?
Well, ablacor.com, ABLACOR.com.